welcome all. Thank you so much for joining us today for this special event in collaboration with Vital Nutrients and Fullscript/Emerson Ecologics. I am Amy Regan from Fullscript, and I'm so glad that you joined us today. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered during the presentation. The webinar is being recorded, and the recording will be sent via email to all attendees and registrants to view later. And there's also a copy of the presentation slides in the handout section for you to download. It is my pleasure to introduce Donna Kent, Sales Director at Vital Nutrients. Donna Kent is not your average sales professional. She's a catalyst for growth and passionate advocate for all things nutrition. Armed with a BS in nutrition science, Donna is not just about crunching numbers. She's dedicated to nurturing health, both in business strategies and on dinner plates. At Vital Nutrients, she offers you 18 years of successful leadership in the healthcare industry, specializing in partnering with healthcare practitioners to optimize patient care and practice revenue. She is adept at nurturing client relationships and delivering tailored solutions with a proven track record of enhancing healthcare practitioner practices through strategic nutrition education and supplement solutions. We're so glad to have you here today, Donna. Welcome.
Hi, thank you so much. I'm excited to introduce our speaker today, John P. Troop, PhD. He is our Chief Science and Education Officer at Vital Nutrients. Dr. John Troop is a thought leader and industry influencer in clinical nutrition and innovator of nutrition therapies. Using the insights of functional and integrative medicine, his clinical insights have provided new guidelines for practitioners and consumers, advancing nutritional management and improving health outcomes. Over 25 years, Dr. Troop has led global R&D and medical affairs teams for Fortune 50 consumer health companies and leading practitioner companies in dietary supplements. Troop's clinical nutrition areas of expertise include digestive health, metabolic and hormonal controls of health and aging, central nervous system response, resolution of inflammation, and epidemiology and health outcomes. Dr. Troop is a sought-after speaker and media contact, delivering more than 1,000 popular webinars and seminars, an author and contributor of more than 75 articles, books, and podcasts, and holder of 10 patent families on nutrition therapies, and has served as an expert industry consultant to the FDA, congressional, and White House committees on nutrition and healthcare. What a treat to have you here today, Dr. Troop. Thank you so much, and let's get started.
Great. Thanks, Donna. And thanks, everybody, for joining us today. I was looking forward to this discussion, and if you've had a chance to join our previous webinars, you'll recall that individually we've spoken about gut health and gut function. We've spoken about HPA axis and all the influential roles that they affect. But today, what I wanted to try to do was have a little fun with the topic, to be honest with you, and talk about the underlying systems and how these two might be integrated. And from that discussion, I think we all are familiar with the concept that as we've been trained, particularly in functional, integrative, and naturopathic medicine, the issue has always been start with the gut first, even in the therapeutic order or therapeutic plans. And today, I'd like to try to answer that question as we go through the balance of the time we have together today. And at the end, come to the conclusion of, is there one that's more important than the other? So a little insight into helping us better understand and evaluate or assess the prioritization of these underlying systems. We have to consider, is there a single system, or are they formally coordinated and integrated in a way that science and clinical insights have just started to introduce and explain to us over the last several years? Is it possible to integrate cross-system signaling and response within the therapeutic order? And the reason why that can become important is that rather than just focusing on the gut, is there a system co-therapy approach that we should be using in managing a number of health conditions? And we'll talk about what those health conditions are as we go through the discussion. The third insight to consider is the gut microbiome influences the metabolome. And we've been focused for so many years about the importance of, say, probiotics and the microflora. But I think only recently are becoming more and more aware and more appreciative of the influence that the microflora has on the microbiome that has an effect on the metabolomic processes in the body. And that's the underlying situation that influences health or the progression to disease. There's a core network of neuroendocrine and communications and metabolic control that's important to understand. And I think while we understand the HPA axis and it related to stress, it's much broader than that and much more important. So the hypothesis and what I want to put forward to today is a concept of, is there a connectome? Is there a way that we can identify connected systems in a way that we can use smarter and more effective co-therapies rather than individual, just the microbiome or just the HPA axis? And how do we bring that together for a more effective and maybe even a faster relief to address the conditions that we face when our patients are coming to us? So fixing the gut means making it work in an integrated way, not just gut function itself and in and of itself, but in a way that influences full, multiply connected underlying systems. And so I hope that by the end of today's discussion, we'll get to the point where we can now do a more effective job clinically modeling care for stress, sleep, digestive health, and women's health in particular. So let's get started. The two systems that we're going to talk about today are really to the left. You'll see the gut function. And we'll talk more about the detail of how the microflora influences the microbiome and also creates what we'll define shortly as the connectome to the right, which is basically the central nervous system communications network. And more specifically, let's just refer to that as the HPA axis that's connected by our neuronal network and in metabolic and hormonal changes that are affected in the gut and that affect communications from metabolic systems to the central nervous system. So it's a broad complex, but I don't think that if we talk about underlying systems, and most of us, if not all of us, have been trained on understanding underlying systems in a functional medicine world, then it's important for us to understand, how do you bring together the systems in a way for greater influence and impact on patient outcomes? So today, what I'd like to spend the rest of our time with is walking through why is this important, and understanding the progression of health requires a coordinated system of communications, and as I just described, a coordinated cross-functional system that influences the biggest conditions that we're trying to manage our patients with. The second part of our discussion will focus on the two pieces of what I'd like to define formally as the connectome, the underlying systems of influence and why they matter and how it works. And we'll break it up into the two major parts: the gut, and specifically the axis of the gut-brain adrenal axis and the metabolic control systems. And I'd like to give you some background on why and how that works. And then we'll spend the second part of that segment talking about the HPA axis and the very specific issues that are caused by stress and communications and systems that can help us better stabilize the systems of care. And then at the very end, we'll talk a little bit about protocols and some of the highlights and come up with that answer is which system is more important and where do you start in the concept of therapeutic order or therapeutic platforms of care. So today, here's a kind of a simplistic view of basically the two systems we're talking about. And let's broadly call them the central nervous system and the digestive system. And they are connected, as we know, both by efferent and afferent network communications. And the metabolic systems are controlled by the metabolome that also result in production of on the activation of metabolic systems and the production of hormone influences. And so as we consider, the HPA axis is central to homeostasis of health, or the balancing of the health system through neuroendocrine communications, and particularly sleep and reproductive systems, metabolic systems that control the response of digestive health. And these are both an important regulators of the immune system and influencers of gut response. The digestive system is foundational to systems of health, and that's influenced by the HPA axis, both by communications to and from the gut. And basically, when the metabolome changes, but the microflora changes, that has a major influence on our metabolic systems and communication systems. So metabolic influences based on the microbiome is an important concept for us to understand and goes way beyond just making sure that we protect the barrier, that we stimulate the immune response, but we're actually activating the metabolic systems that are so important in the progression of disease states or the recovery from disease states into foundational effective health. So why is this important? We all know that the chronic diseases are at an all-time high in America. They keep creeping up on us and growing. 6 in 10 Americans today suffer from some kind of a chronic disease. And part of the solution is what we do to the gut and the microflora, the metabolome that we've created that then changes the communication system for many of our patients. And so clearly there's a 1-2 step here. And the issue is what comes first and how do you prioritize one system or the other, or frankly, do you? And so ultimately what we're really talking about is an integrated system of care that is probably most simply described as a stress response system, but plays such a fundamental and pivotal role in our ability to manage patient outcomes because they affect major issues, not only stress, but they affect other areas that can help us recover or become resilient. So circadian disruption, inflammatory signals and immune response, and dysregulation of metabolic systems, particularly the glycemic dysregulation. So now we're talking about influences on major systems, not only activation of cell receptors that start metabolic processes, but also help us regulate glycemic control, metabolic control, hormonal control, and all of this then becomes major issues that can very simply be better managed if we start from the very beginning in a coordinated Connect-ome process. So why is this important? If you look at some recent findings provided by Living Matrix several years ago, there's a clear association now with levels of stress related to dysfunctionality or a lack of coordinated integration of major systems in the body. And that leads to stress, leads to dysfunctions and alterations of metabolic controls and systems. And then that leads to some of the major health conditions that we're seeing across our patient population, whether that's the development of obesity, more specific and advanced digestive disorders, thyroid issues, but also cardiovascular diseases and a number of other chronic health conditions. And so some of these include heart disease, high blood pressure, diabetes, in particular insulin resistance and a lack of glucose control. That also leads to liver dysfunction and a whole cascade of other chronic diseases that progress. Infertility is probably a less appreciated issue as a result of lack of coordination of these systems. And sleep disorders just make everything worse. It affects and complicates metabolic disorders. It affects and complicates immune system recovery, and then can actually lead to even more advanced issues of stress, including anxiety, occasional anxiousness, and mood disorders leading to depression. And so if we can understand what these conditions are and how they are influenced by our underlying systems, we can have a better appreciation of how to design specific clinical protocols that address this connectome. And so if you just take a look at, and we'll talk more about some of the mechanism of actions and underlying effects of how does sleep disorder and disruption of sleep cause or involve in chronic health disease, you can see that if there's a lack of deep sleep or lack of fully recoverable sleep, that of all the conditions listed on the left of this table, there's a significant increase in the development of risk of each of these conditions. So fundamentally, being able to stabilize our systems in a way that stabilizes the response of those systems, for example, better sleep, then it gives us a better chance to stabilize our patients and help make sure that they maintain resiliency and can avoid the progression of disease states and even be able to recover into a more normal balanced state. So with that as a background, and I hope we've just reconfirmed with you all the importance of these underlying systems on health states and health status. Let's talk a little bit about some of the underlying mechanisms. And I'd like to briefly go through some of the detail here just to provide an appreciation of how and why these systems work and how and why they're so important. Let's start with the gut first. And we know that influencing the gut microbiota is really important. It has protective functions. It provides structural and histological functions, and most importantly, metabolic functions. And the combined balance of these three features of gut science are really an important role. But the most important is it's one thing to look at what we put into our gut. And it's not only about probiotics or prebiotics or even the foods that we eat, but it's important in how they all come together, because how they come together basically determines what the intermediate metabolites are that are found in the gut, whether it's in the small intestine or the large intestine. And that will have a major effect on the metabolomic processes that develop into very specific systems, for example, the cardiovascular system, or even the ability of what's in our gut to influence a nervous system and then network communications that could lead to confounding variables like stress. And so understanding that what we know today has grown so much beyond what we knew, say, 20 or 25 years ago on just improving microflora, but basically how that microflora works to be able to change the metabolic potential of our bodies. And so we now know today that the microbiota, which defines the microbiome and the metabolome, have major influences on these health systems, whether it's just metabolic health or even body weight regulation, but also immune modulation and intestinal permeability are all a coordinated, consolidated response to what the metabolomic profile of our guts are. And so here are really two important panels and slides that help define the connectome. The connectome is the response of what's in our gut to communicate with the rest of the body through the neuro-endocrine system and the HPA axis. And so we now know that the gut microbiota influences central nervous system response. The gut-derived intermediates will then influence not only the health and the functionality of the gut itself, but it'll also create a metabolic process and a metabolome that then influences our ability to communicate across the body. And so how we influence the gut flora, if you will, can be determined from host-derived situations, diet-derived, or what we put into our bodies, our microbiome profile, because certain probiotics and microflora will generate their own set of intermediate metabolites or affect the breakdown of energy sources. And then there's de novo synthesis of precursors from our gut. And so there are important intermediate metabolites that, if you will, the milieu of what we put in our gut that could be strain specific. It could be just a natural response of how our bodies naturally respond. They all will create intermediate metabolites. So, for example, there may be tryptophan precursors or GABA precursors that are generated by all of those four sources of changes in the gut flora, to the point that how we communicate with our central nervous system and metabolic systems will be influenced by those changes. And so the ability to communicate cross-functionally across systems into major systems of influence, like the neuroendocrine system, is what I call now the Connect-ome. And that's been well documented in the scientific literature, and particularly in the last 2 years, there's been significant amount of research that have validated and confirmed these mechanistic changes of influence that play significant roles in not only our ability to help and manage issues important to our patients, but also to improve their health communications and address the progression of health issues that this causes as an underlying feature of our bodies. And so if we start with what's happening in the gut and some of the changes I just described, is dysbiosis will alter the metabolome and lead to a progression to digestive disorders. So I would hypothesize and propose to you that just by changing the microflora or the colonization of the gut, or the probiotics that we use that may have a fleeting but highly influential effect on the development of metabolites in the gut, that's not going to be enough unless we consistently provide a program that's then able to decide how much of our gut and what's happening as intermediate metabolites in the metabolome of the gut can influence communications to the rest of the body and with the rest of the body. So being able to stabilize and balance the microflora and microbiome is really important, is really a step one in the process. To be able to balance the metabolome and optimize the microbiome in a way that it optimizes communications to the other key system, which I would propose to you is really the central nervous system, and more specifically the HPA axis, the interconnected ability to influence, balance, and stabilize those two systems become really important in our ability to have a maximal effect on whether it's the immune system response, immune modulation leading to inflammation resilience and resolution, and then ultimately the metabolic contribution that are played in the development of various disease states, particularly in obesity and diabetes, are all really important. And so let's look at what we now know. For a while, about 5 to 10 years ago, and still today, there's a lot of discussion on symbiotics. And so symbiotics are important because it's really about the ability to bring together and capture the complementary or even synergistic effect of pre and probiotics. But what we now know today, that prebiotics that particularly include phytonutrients from foods that we eat or specialized strains of probiotics play a significant role in what metabolites can actually be formed by their breakdown. So as we introduce foods into the body, and they may be phytonutrients as I would model here to the right of this chart, that they're broken down by the activity and the interrelationships of the probiotic strains in a way that then create other intermediate metabolites that are then precursors to the development or influence of other systems. And in particular, if it's related to the central nervous system communications and the ability to activate not only metabolic systems of response, but central nervous system responses, now you either got a major problem or you've got a faster way to address the health response of your patients. And so the interaction coordination of the metabolome and the neuro-endocrine communications is critical to the balance of health. How does it work? And so this slide, rather than spending a lot of time and overcomplicating our discussion for today, is really important. But the take-home message is that starting with the gut, what we introduce in the milieu, in the environment that we create there with the right set of substrates or nutrients, with the right profile of specific probiotic strains, can then determine what metabolic intermediates or precursors are produced. So we now know today that with the right profile of foods, the right combination and use of probiotics, intermediate metabolites are formed. And in particular, tryptophan has been identified as a very important intermediate metabolite from the breakdown of our foods that then you can imagine are able to influence central nervous system communications and for sure can influence the metabolic pathways and processes. And so our ability to be able to influence these two worlds become really important and define the connectome for us. Sorry, got a little ahead of myself here. And so tryptophan is a key metabolite that's produced in the gut that influences the metabolome and network communications. And it's important that we realize is that tryptophan can be a precursor to the development of in other intermediate metabolites, including serotonin, that can also then influence the production and availability of melatonin. And so not only are we seeing a communication influence from the network to the HPA axis that could then result in the release of cortisol, we can also see metabolic pathways that would be influencing the production of other intermediate metabolites that downstream can affect major issues that are important, like sleep. Excuse me. So the connectome is the link maximizing two underlying systems of influence and addresses both the metabolic and the neuroendocrine basis of chronic health issues in their progression to compromise health concerns. So 90% of the central nervous system is made up of the efferent network, and it's found in the gut. So that's the neurons in the nervous system that go to the gut. And we can define those as parasympathetic or sympathetic nervous system. And so where there are times where we get nervous or have maybe dysfunctional guts or gastric distress, a lot of that can be traced to, very simply, the efferent network. But most underappreciated is the fact that 15% of the central nervous system are afferent networks, and they leave the gut going to the central nervous system, and in particular in the central nervous system, and then connect to the HPA axis and sequence of events important in that hierarchy of activation. So how does that work? So in the left panel, you'll see the gut lumen at the very top of that black line box. Is the changes of the metabolome in the gut lumen then can influence the rest of the body in two ways. They produce metabolites that could be absorbed directly, and they then influence biochemical pathways, or their conversion and crossing the membranes can also influence the central nervous system at the submucosal levels in the mesenteric plexus of the tissue of the gut lining. And so the ability then to activate the afferent nerves is then done in this process of influence. And you can see now that what we put into our guts and what we then allow the metabolome to become has an ability to communicate. And that link today is the connectome that we're talking about. And so the connectome is an integrated system of activation and control, and it includes the ability of these metabolites to cross the gut barrier and the gut lining. And then once they get into the blood system, they'll be absorbed. They'll play a role in liver metabolic processes and metabolic processes of the rest of the body. So I would argue today and present to you that the ability to separate gut function and the microflora and the metabolism of the gut from basically the central nervous system communications, and particularly the neuroendocrine communications, is impossible because they're so tightly connected and they have such a fast-acting response into how our systems and then how our health system profiles can respond. There's been a lot of recent research that shows the control mechanisms that link the gut to the central nervous system. And they've already identified a number of different afferent nervous system structures that are influenced by metabolites. They're influenced by metabolite communications to the activation of the central nervous system, and then also to cell receptors that are then activated as well, that then communicate with the central nervous system and then have a pathway of communication that influences either complications and progression to complications or cascade into long-term changes in metabolic response. So with that little really quick summary of gut response, let's go to the central nervous system and then talk about the associated influence. I think we're all familiar with the stress response system. We can look at that and define the HPA simply as that stress response system. But it all starts with the communication of that central nervous system. And then ultimately, let's not forget that really cortisol is called a stress hormone, but it also helps to modulate the immune response in a way that could then help us manage and reduce an inflammatory response. So it plays a significant role in the immune system. So not only are there immune cells in the gut, and we've all heard 70% of the immune system is in the gut, but as and perhaps even more importantly, I would argue that 15% of the central nervous system is made up of immune cells, particularly in the form of microglial cells, and they're all influenced by these intermediate metabolites, and so they somehow then also need to be managed as well. And so chronic HPA dysregulation results into the increased stressor response, but it can all be balanced by being aware of and being able to cross-functionally manage and influence the connectome. And so if we're able to do that, we have a chance of influencing really in one therapeutic approach, a neuroendocrine balance, which can impact sleep and even reproductive health. We'll talk about that in a couple of slides. We can make sure that the underlying systems are resilient. The new concept of autophagy and the ability for our systems to recover and heal itself, particularly at nighttime and during restful sleep, becomes really important. The ability to resolve the inflammatory process through the activation of the glial cells or the immune cells in the central nervous system by the use of things like omega-3s and DHA and resolvents are really important. And all of those, particularly in a nutrition delivery vehicle, influence and change the metabolome of the gut in a way that the connectome can be maximized in this cross-functional communications. And so again, back to this slide, we can see the brain, central nervous system, the brain connected as an axis to the microflora And the microflora then affects gut function because of the metabolome and the metabolite profile that are then changed. And so this axis more effectively describes what the connectome is, and perhaps maybe in a more simple way, but it's clear to see how the two can be linked in a way that we can influence it. And so normal stress response would be the normal communications. A healthy gut has healthy communications, the neuroendocrine balance, the right intermediate products are all coordinated. And in a case where in the gut, the metabolome has significantly changed, and the alteration in the network communication and the activation in the neuroendocrine communication and hormone release will be thrown off balance to the point where chronic stress will result in really cortisol resistance, which I would describe more as adrenal fatigue, and that ultimately the metabolome and the connectome communications have been altered. And the good news in all of this is understanding this 1-2 series of and sequence of events can be managed and reset, rebalanced, and then reactivated. So the HPA axis is responsible for an accelerated response. Basically, while the body is actually trying to heal itself by the release of cortisol, we also know that that creates, particularly left unchecked and left out of balance, that'll lead to overstress, and that the body becomes resistant to that response to try to balance it, that we'll see impaired functional responses. And the reason why impaired functional responses like poor sleep or lack of resilient or deep sleep becomes really problematic is the body then doesn't allow itself to heal, and doesn't allow the metabolome and the central nervous system communications to heal itself and to communicate to its normal high level of responsivity. And so it's these complications that are unintended, but if they're not well managed, will progress in their own right and make it harder to reset the body, to rebalance the body, and to allow it to recover and to have normal functional response. And so the two prioritized systems, I believe, are underappreciated as connected systems. And that's really the key point of today's discussion is it's not one or the other. It basically is about how do you make sure that we're connecting to optimize everything that will influence the communication piece and that may have an influence on the progression of these health conditions or altered health states. And so we can see, if we talk about underlying systems, the microbiome and the HPA axis are clearly connected. We understand now to the right, the stress system itself, which is basically a response to the complications of a lack of management of the communication or the connectome that leads to a stress system, because the body is now out of balance or resistant to cortisol, if you will, and that normal self-healing process that should be taking place. And so, again, I wanted to highlight the importance of the intermediate metabolites that are produced that create the metabolome for us. And tryptophan is just one example. I think we know tryptophan is an important precursor to serotonin, an important precursor to melatonin. And if the stress system gets out of whack because of the poor communication of the connectome, we know that we've got major issues that continue to get worse or that aren't allowed to be reset or put into rebalance. So gut metabolites can be enablers of the connectome. They're influenced by diet. They're influenced by probiotic strains. They're influenced by an activation of the metabolic process of health, neuroendocrine signaling, and influence of underlying resiliency. Several years ago, a major review study was undertaken by colleagues at Harvard School of Public Health, where they tried to look at if you have a dysfunctional stress response as a result of an unconnected connectome, if you will, they were able to track these down into major mechanistic effects that compromise health status. And so if there's a change in neurochemical alterations, they could track that down to psychological and mood disorders and health problems, and even more specifically as regards women's health, into a breakdown of reproductive health status. And if those are left dysfunctional and not balanced, then we can also track those same systems into more difficult menopause and menopause transition states. And ultimately, if perimenopause was problematic and challenging, we'll also see those same cohorts of individuals would have a more difficult transition into healthy aging. And so these systems and the connectome is so important that not only does it affect a specific health span, it also affects life stages and our ability to respond to health states as a result of an ineffective connectome. Let's talk a little bit as more specific examples of the influence that the connectome can have, and probably the best example is sleep disruption. We've been talking a little bit about the coordinated system via the connectome that I just described that affects sleep. And we now know today that stress response can be affected by cortisol that doesn't basically reset itself. And so clearly there are clear links. Cortisol increases, melatonin decreases. As cortisol falls out of balance, sleep cycles are disrupted. Sleep disruption leads to progression of health complications through both endocrine and metabolic effects. And most of that is primarily because autophagy or resilience and recovery and immune modulation and resolution of inflammation aren't allowed to completely take place. And the cascade of these disruptive systems or dysregulated systems, if they happen all in parallel, can also complicate more specific issues like reproductive health and can frankly lead into infertility or generally fertility problems. And so microbial metabolites, in particular tryptophan and GABA, are just two examples. We could also consider the production of short-chain fatty acids and butyrate as another important intermediate metabolite in these cross-functional systems of the connectome. So this is an example of how the systems, when they're not operating in balance together, can lead to an increased state of stressor response and more specifically affect sleep. Also important, and only really in the last 5 to 7 years, we've learned a lot more now about melatonin itself. And melatonin in its own right is not just a sleep hormone, but it's also recognized now as an intermediate metabolite that plays a key role in the connectome. And if melatonin is available through these series of connections from the precursor of tryptophan to serotonin to melatonin, we also know that the body's ability to be resilient and improve quality of sleep becomes much harder to accomplish. And so melatonin, we now know today, it plays an important antioxidant role. Its recovery in antioxidant through the NRF2 activation system becomes really important, and its ability to influence immune modulatory response, particularly to help resolve inflammatory states, is really important. So it's not just a sleep hormone. It's part of the connectome that is really important. And we now know, too, that melatonin plays an important role in metabolic processes, both in the liver, in skeletal muscle, and in the pancreas, to the point that melatonin can activate the system and address carbohydrate metabolism in a more efficient and functional way, so that basically the development of insulin resistance and its progression into states like prediabetes or diabetes can also be avoided. And so the recovery of the immune modulatory system associated with these carbohydrate and protein metabolic systems can be enhanced. And so these systems, and particularly ingredients and components like melatonin, play a really important role in these cross-functional systems. So melatonin, as a key intermediate metabolite, can be facilitated by the use of exogenous melatonin in a way that can help address deep sleep. It can also provide a more robust communication network of the connectome, and to be able to make sure that the metabolomic and the central nervous system communications can help minimize a stressor response that's out of control. Melatonin plays a role both then as a metabolite and CNS, central nervous system influence, that can affect sleep cycles and can affect deep sleep for recovery. And it's now possible for us to be able to identify the specific role of how any system can be influenced by or produce melatonin. And we also now know that what food items can be broken down into what active metabolites that could also lead into the production of melatonin and its own intermediate metabolites that can have an impact on the connectome and frankly, some of the stress, sleep, and recovery cycles. Let's talk a little bit about another probably less appreciated system, and that's the neuroendocrine response, and particularly the connection of the the microbiome and metabolome, its influence on HPA, and those metabolic changes in central nervous system communications that affect not only HPA axis, but also its interaction to the hypothyroid gonadal axis that influences and has a negative effect on reproductive health. And so today we know that HPA axis is a central influencer. Not only does it affect sleep deprivation, but it also changes the ability to release certain hormones and the communication precursor or hormones that then affect the stimulation and release of some of the major reproductive systems. So it's a two-step process. The stressors themselves and sleep deprivation can affect and lead to infertility directly, but also the release of cortisol and the status of the neuroendocrine systems themselves can change the hormone balance in a way that leads to infertility. And so again, that's why the Connect-ome can be such an important component to consider in managing the issues of our patients. And this slide, I think, does a nice job of highlighting really how these systems are connected. And so we know that increases in choreotropic releasing hormone can play an important role to a precursor production of LH and FSH. And we also know that there are inhibitory actions of cortisol that will also influence and change gonadotropin releasing hormones that in effect can change levels of luteinizing hormone and FSH to the point where there may be dysfunction in the reproductive response and reproductive status, both in terms of ovarian health, but also even in the ability to produce sperm and sperm health, and then ultimately even in the viability of the embryos in the gut. So the stress response really, and the need then to look at, particularly for those patients that may be having reproductive issues and in particular may be addressing fertility, is the ability to be able to balance hormone response in a communications through this Connect-ome and the stressor response. Let's not forget about the endocannabinoid system. And today we now know that the endocannabinoid system is an important activator system in its own right. The good news is that we've learned a lot about that, where it's not about taking CBD anymore, but it's understanding what the precursors to these metabolites are and to what their cell activators really are. And we know that the precursor to the development of endocannabinoids are basically omega-3 fatty acids. And so taking enough omega-3 fatty acid plays an important role in changing the metabolome of the gut and its ability to have central nervous system influence on communication. So we also know that omega-3s are precursors to endocannabinoids. We also know that omega-3s help produce specialized probe-resolving mediators, and those are really important in activating the microglia so that the system can resolve itself. We also know that more importantly than cannabidiol, that there are phytonutrients that are called terpenes, and in particular beta-caryophyllene, that plays a significant role in activating the CB2 receptors. And these CB2 receptors activated by terpenes are also found in the gut. They're also considered to be beta receptors that they stimulate, and beta receptors also help the communication in the metabolomic system to help address issues like carbohydrate metabolism that could then affect the cascade in the liver to the development and use of or the avoidance of insulin resistance at the liver level. So we know endocannabinoids help potential targets and potentiate targets in the maintenance of this homeostasis. And so they play a very key activation role of receptor activators in this Connect-ome. And so high quality diet, as we've been talking about near the beginning of this discussion, will determine what intermediate metabolites there are and how and what they activate. And we know that phytonutrients play an important role, particularly terpenes, related to specific interface with specific strains of phytonutrients, and probiotic strains in particular played an important role because they determine what intermediate metabolites are then available in the body to then influence the entire Connect-ome. And so as an example, serotonin again, tryptophan are important, GABA production are important, and then the ability to interface with all of these cell systems and metabolic systems become an important consideration when looking at the stressor response, particularly sleep, the reduction of anxiety, even the relief of pain and more healthy pain response, and also the calming general relaxation. Play an important role in being able to put it all together, from what's causing the major stimulus, what's causing the major activation of the receptor cell systems so they can have a response, and what's affecting the neuroendocrine response is also important. And so understanding what phytonutrients play an important role in activating the receptors is important. And this slide shows that there are specific herbs, whether it's curcumin and boswellia, or combinations with high sources and effective sources of terpenes like copaiba oil, becomes really important consideration in selecting what's your nutrient arsenal that can maximize the ability to influence the connectome. And as a result, we also have the associated effects of items like rhodiola and ashwagandha can also help rebalance cortisol and to be able to balance the stressor response. And it's not ashwagandha and the actives themselves, but it's their breakdown intermediate products that influence that communication system that we should be aware of. And so what I hope that I've done was initially painted the issue of why are the connectome such an important role in the communications and their ability to balance these systems so important. It's because they lead to the progression and complications of health states. We can narrow it down to really 2 or 3 major systems. It's the gut, and then that gut-brain adrenal axis, and it's more specifically the central nervous system neuroendocrine communications that then lead to really an out-of-balance system that can influence stress and the associated systems that make the connectome more influential, and more importantly, play a bigger role in being able to balance the systems. So we have clinical guidelines that are available, and I think after this seminar, it's possible to go online and to be able to download some of these decision trees, and they're tied to specific use of very specific nutrients that are available to help manage the connectome. And so rather than going through this in more detail, I'll really suggest that you go online and take a look at the landing pages that we've created that will connect you to these clinical protocols. And so we have nutrient gap, and we also have protocols that will more specifically address the connectome to the ability to manage deep sleep or restful sleep. And so with that, let me summarize. And so we have some time for questions here. And let's get back to the question that I posed at the very beginning, which is more important, the gut or the HPA axis? And then basically, as I hope you probably figured out in the first 10 minutes of this discussion, it's both. It's not either, but it's both. And so it's the connectome, which is defined by both the gut function and the metabolome of the gut, but also the ability to influence neuroendocrine communications. And so the connectome is the prioritized system that requires the balanced co-therapy approach. It involves recognizing and co-managing the gut with the HPA axis and the endocannabinoid system. And as a result of that, the key health issues that tend to be the spark that lead to the progression and the decline or dysregulation of major healthcare systems can be addressed. And that includes the metabolic systems that will affect patients that are addressing obesity, prediabetes, diabetes, cardiovascular health, and digestive conditions, and reproductive health. Not to mention cognitive performance, which is not only focus and attention, but also cognitive performance in a way that will be influenced by these stressor states, and then they cascade into mood state themselves. The benefit of managing the connectome is resiliency. It's a basic ability to respond and to rebalance itself so that these systems can be better coordinated and supportive. And the supportive nutrients and metabolites that are most important in what we've been talking about include melatonin, serotonin, and other precursors, ashwagandha, copaiba oil, boswellia, omega-3 fatty acids, and specialized pro-resolving mediators are all important considerations that really play a significant role in managing the connectome. So with that, let me stop here. Thank you for the privilege of your time today and your attention and participating. And I'm happy in the time that we have remaining to answer any more specific questions and next steps in therapeutic care as a result of this discussion. Thanks,
Thank
Amy.
you so much, John. Oh my goodness, what a packed presentation. That is what we've come to expect from presentations from you, John. So we really appreciate it. So we do have a number of questions, so I'm going to jump right into that. Mark asks if you can please address any pain syndromes you are aware of that might be found in women with leaky gut and undiagnosed autoimmune syndrome.
And the first part of that question was just to address pain.
Yes, yeah, pain syndromes.
Yeah. So I think that the issue, in the gut with leaky gut is really twofold. One is you've got an acceleration of inflammatory response, and a lot of that will be further complicated by metabolites, and in some cases probably undesirable metabolites. But also there's the communication of the influence of the central nervous system network that needs some help. And so, as I mentioned, the microglia in the central nervous system also need to be activated. And there are two ways that you get the right metabolites into the gut to heal leaky gut, but also to make sure that the communication network is in play. And that's really in making sure that the availability of specialized pro-resolving mediators can help dampen the response, reset and rebalance both the central nervous system and heal the gut. And as a result, the outcome, if you can reduce inflammation, clearly you can also reduce the response of pain.
Excellent. Chris asks if you have any thoughts on PEA. I'm not going to try to pronounce the full word here. It's palitholamine, PEA. He said that he just has a client ask him about it, and he's now doing further research and would like your thoughts on in regards to fibromyalgia and pain.
Yeah, it's actually been a while since I looked at that for those studies, and I've forgotten more than I recall right now. So I'm not going to be able to give you a great answer. But the previous explanation is really closely related, I think, to your question and what you would use as nutrient solutions. And a lot of PEA, as I recall, is also linked to the resolvin pathways and the resolvin influence. And so I apologize for not giving you an answer, a great answer, but I'd ask you to take a look at SPNs as an example, and the terpenes and the beta-caryophyllene.
Excellent. We're definitely putting you on the spot, John. Excellent. So we have a number of questions specifically about melatonin. Alexandra asks, how long can a person take melatonin without developing a dependence?
Some of the research that I've read would suggest that there's really a low risk on developing a dependency on melatonin. Although that dependency may be real in that the behavioral addiction centers of the body might in our own reaction or expectation might cause that. I would call it a kind of a self-developed dependency rather than a chemical dependency. Mm-hmm. Nevertheless, they're dependencies. And so I think we just have to accept that. But generally speaking, I would always look at any of the nutrients we're talking about as to most effectively to be used on 12-week cycles. And so 12-week cycles would be what I would feel comfortable with suggesting to you that the therapeutic windows. And so after 12 weeks, the therapy should be evaluated, reevaluated, and reassessed, stopped, wait for a 3 to 6 week washout period and see if the situation is resolved, and then reassess what should be done in the next 12-week therapeutic window.
Excellent. And as a follow-up to that, Alexandra asks, if a person takes melatonin as a supplement, will it reduce the amount of melatonin that our bodies naturally produce?
No, so there hasn't been that finding yet, and that's also true with a number of other nutrients. We always ask that question, right? Is that happening? But I'm not personally familiar with any of the studies that may have shown that. And in fact, to the contrary of that, I've seen studies that don't reveal or suggest that. So I don't think that's an issue. And again, I would suggest think about these 12-week therapeutic windows just to be sure, where if there is any risk of that, then I think it can be minimized and more directly addressed.
Excellent. And can you speak to melatonin dosing? Shelley is wondering, is a smaller dose more effective? Just kind of what you would suggest for that.
Yeah, so the what I would call an effective clinical threshold of melatonin really ranges from 1 to 9 milligrams. And I think that specifically for restful sleep, and even without, say, a perceived grogginess afterwards, that really 6 to 9 milligrams of melatonin seems to be a generally most effective dose. But again, it depends on individual sensitivities and individual patient response. So again, back to, and in this case for melatonin use and dose response, I would break the therapeutic window, that 12-week window, into blocks of 3-week blocks. Mm-hmm. And then either do dose escalation or dose de-escalation, depending on your patients and how they responded with your care in the past.
Excellent. Juliet also has a question on melatonin and says that many of their patients experience nightmares and night terrors after and wake up after the melatonin has worn off. Do you know of any other options in this case?
Yeah, there are a number of what I would call melatonin-free products that are available, or melatonin at significantly lower levels that are part of a nutrient blend. And so those include theanine, L-theanine, ashwagandha, copaiba oil, and the terpenes themselves can play an important role in resetting that.
Excellent. Moving on to some omega-3 questions. Gina asks, you mentioned omega-3 being important. Are you referring to DHA, EPA, or ALA, or both?
DHA and EPA in particular, and of those two, DHA more so than EPA. DHA is an important precursor to the development of specific resolvins and their ability to affect specific central nervous system and metabolic system activation. So DHA in particular, and so if you could find and you feel comfortable with a high DHA omega-3 oil, that's where I would suggest you go first, or DHA that also has quantifiable levels of SPM would be also an important product.
Excellent. Mark asks if you have any comments regarding black seed oil with respect to anti-inflammatory and other effects.
Yeah, the emerging science there would suggest that can play a complementary effect, much like curcumin does, or boswellia. And so as I would look at or think about what are the complementary botanicals or nutrients that can help resolve inflammation or immune modulatory effect. And by that, I mean omega-3, DHA, and SPMs would be your starting point. And then complementary to that would be black seed, nigella, or boswellia, or curcumin, or a combination, particularly of boswellia, curcumin, and quercetin. Like BCQ combinations play an important role. So any of those combinations can play a very effective role in managing that issue.
Excellent. Christy asks, are there any supplemental combination formulas that would address the connectome?
I'm sorry, any what formulas?
Supplemental combination formulas. So something
yeah, a lot of what we've been talking about here. So for example, if you look at products that address cortisol balance, and so that's the combination of ashwagandha, copaiba, rhodiola. Those are important combinations. Omega-3 SPMs are important combinations to look at balancing that. Melatonin, 5-HTP are also important combinations. In combinations of phytonutrients, for example, a combination of boswellia, curcumin, and quercetin are important. So yeah, there's a lot out there, and I know that Vital Nutrients has a nice portfolio that are very effective and complementary to managing the connectome.
Excellent. We have a little bit of a specific question here. Louisa is wondering about depression in postmenopausal women, thinking, is it due to estrogen decline or sleep disruption? They're sort of looking into things that contributing factors that may have affected their major depression symptoms, besides psychological factors, of course. Just anything that you can kind of share.
Yeah, that's we've been tracking the science in that area now more and more closely, and it is a major and growing issue of concern. And so I believe right now at this state of still collecting information and studying the category, a lot of it appears to be related to the stressor response. And if you remember that one chart that I described that had stressor at the top and presented 4 or 5 mechanisms. One of the resulting mechanisms results into altered mood states and depression, and that could be postpartum depression as well. So we know that sequence of events from the stressor systems may be playing a role in that, and so the ability to manage everything that we've been talking about today is important. And so we know that particularly that for those couples that may have a challenge in conceiving, to have had to address infertility specifically, they may already be at a predisposed state to experience postpartum depression. So it's important to ask the right questions as part of the whole therapeutic order or functional medicine matrix in a way that better understands all the risk factors and experiences of the patient to then address these things proactively.
Excellent. So we're just hitting our 3 o'clock mark here. We just have a couple more questions to answer. So I'm just going to go along here. Catherine is wondering, do you have a probiotic choice for healing the gut? Are you aware of BrainTap? And if so, do you see this as a good tool to reestablish a proper alignment with the HPA axis?
Yeah, so I'm not familiar with the specific. It sounded like it was a product called BrainTap. But was that a movie or was that called Spinal Tap? Anyway, so
I think Spinal Tap.
Yeah. So I'm not familiar with that product. I'll look it up now. But thanks for asking that question. Let us know that there are a number of strains that are available, including in the hyperbiotics line. I know there's a product called Gut Integrity that can help manage that. And leaky gut is probably a good example of what's the connection or what's the outcome of an altered connectome, results in leaky gut. And then all the communications, the metabolism and the central nervous system communications are thrown out of whack. So that's a good example. So addressing leaky gut can help this. And I know there's one strain, L. salivarius in particular, helps leaky gut. The integrity balance and the hyperbiotic line also manages healthy gut. So those are just 2 examples that you might take a look at.
Excellent. And do you know if there are any specific strains of probiotics that can benefit the mental stress aspects of postmenopause? Chantel is wondering.
I don't yet. We are in search of that and reviewing the science right now. But as soon as we do, I hope that we'll have a chance to provide another webinar and we can talk specifically about that.
Excellent. And the last question that we have comes from Kenton, and they wonder, does the connectome contribute to ASD symptoms that you know of?
Not that I'm familiar with yet. So thanks for asking that question. I'll start taking a look at that.
Excellent. So I just want to say thank you so much to everyone who attended today. And thank you also to John for this great presentation. Everyone keep an eye out on their email with a link to view this recording, as well as a special offer from Vital Nutrients. Anyone who has any additional questions can send them to me at amy.regan, amy.regan @fullscript.com. And John, any closing thoughts for us as we sort of finish up here?
No, don't hesitate. If you have any questions, please send them, I think, to you, Amy, and Amy gets them to us, and we're happy to respond to that. And lastly, I just thank you for all the good work that you guys do in taking care of our patients and improving health outcomes. And thanks for the privilege of your time today.
Our pleasure. Thank you so much, John. We'll talk to everybody soon. Enjoy your afternoon.
Bye-bye.